Every 40 seconds, someone in the United States has a heart attack. That's faster than you can skip the ads on a YouTube video. The surprising part is, many people don't even realize what's happening, because it's nothing like what you see in the movies. No dramatic collapse or clutching of the chest. Often, the reality is much quieter, more confusing, and incredibly subtle. So would you know what to look for? Not just the classic signs, but the silent ones. The ones that feel like the flu, indigestion, or just being unusually tired. Recognizing the difference could save a life. Maybe even your own. Today, we're breaking down the critical warning signs of a myocardial infarction, the medical term for a heart attack. We'll cover both the textbook symptoms and the commonly missed ones. Understanding these signs is a powerful step toward protecting yourself and those you love. Section 1. Why so many signs are missed. A myocardial infarction occurs when blood flow to part of the heart becomes blocked, usually by a clot. Without oxygen-rich blood, the affected heart muscle starts to suffer. The longer that flow is blocked, the more strain and potential damage occurs to heart tissue. That's why every minute counts. But the body's warning system doesn't always show up as loud chest pain. It can be subtle, easily mistaken for heartburn, fatigue, or anxiety. This is especially true for women, older adults, and people with diabetes whose symptoms may look completely different. Most of us have been trained to expect a dramatic Hollywood heart attack, but real-life symptoms can whisper long before they ever shout. That's why it's so important to recognize the quiet, early warnings before things escalate. Section 2. The classic warning signs you should never ignore. Let's begin with the most recognized signs. If you experience any of these, don't wait. Take action immediately. 1. Chest discomfort. This is the most common symptom, but it's not always sharp or stabbing. Many describe it as a pressure, tightness, squeezing, or heavy ache in the center or left side of the chest. It might come and go or feel constant. A common description. It felt like an elephant sitting on my chest. 2. Radiating pain. Discomfort can travel to other areas like the arms, especially the left, back, neck, jaw, or even the upper stomach. It might not feel severe, just a persistent ache or pressure. This can occur with or without chest discomfort. 3. Shortness of breath. You may feel like you can't catch your breath, even while resting or doing light activity. This happens when the heart isn't pumping effectively, affecting how your lungs manage oxygen. 4. Cold sweat. Breaking out in a sudden cold, clammy sweat is another red flag. It often comes with a feeling of unease or nervousness. 5. Nausea or lightheadedness. You might feel sick to your stomach or even vomit. Some people experience dizziness, faintness, or a sensation that they're about to pass out. These symptoms occur as your body and brain react to reduced blood flow and stress. If you notice a combination of these symptoms, even if they're mild or come and go, do not ignore them. They may be signaling a serious emergency. Section 3. The silent or atypical signs you might miss. Now let's talk about the symptoms that are easy to overlook but just as dangerous. These often get mistaken for something less serious. 1. Unusual fatigue. This isn't just being tired after a long day. It's a deep, unexplained exhaustion, like your body is completely drained. It might show up days or even weeks before a heart attack, especially in women. 2. Indigestion or discomfort in the upper stomach. This may feel like acid reflux, a burning sensation, or stomach discomfort. If it doesn't go away with usual remedies, or is paired with other symptoms like lightheadedness or sweating, take it seriously. 3. Isolated pain in the jaw, neck, or back. Pain that shows up only in these areas, without chest discomfort, can also signal a heart attack. You might feel an ache in your jaw, a tight throat, or a dull pain between your shoulder blades. 4. Sudden anxiety or a sense of doom. A heart attack can trigger a powerful, unexplainable feeling of anxiety or dread. It might come before physical symptoms and should not be dismissed as just stress. These are all real physiological responses, not overreactions. If they're new, unexplained, or feel off, it's better to be cautious. Section 4. Special considerations for women, older adults, and people with diabetes. For women, heart disease is the #1 cause of death in women, but symptoms are often dismissed. While chest pain is still common, women are more likely to report shortness of breath, fatigue, nausea, or pain in the jaw, back, or shoulders, sometimes without any chest pain at all. For older adults, as people age, pain signals can be less intense. Older adults may have little to no chest pain, but may experience confusion, weakness, shortness of breath, or dizziness. These signs are sometimes misattributed to aging or unrelated conditions. For people with diabetes, diabetes can damage nerves, dulling the body's pain signals. Someone with diabetes might have a serious cardiac event and only experience mild symptoms, like fatigue, indigestion, or shortness of breath. Any new unexplained symptoms in this group should be taken seriously. Section 5. What to do? Don't drive. Call emergency services. If you or someone nearby experiences these symptoms, call emergency services immediately. Do not try to drive yourself or let someone else drive you. Here's why calling an ambulance matters. Immediate care starts on arrival. EMTs can give oxygen, run an EKG, and administer medication on the spot, potentially preventing serious complications. They're trained for emergencies. If the heart stops en route, EMTs can provide CPR and defibrillation, life-saving interventions that simply aren't possible in a car. Faster hospital access. Paramedics alert the hospital ahead of time, allowing you to go directly to a cardiac unit and skip delays in the emergency room. Remember the phrase, time is muscle. The faster you get help, the more heart tissue can be preserved. It's always better to call and have it be a false alarm than to delay in a real emergency. The signs of a heart attack can be loud or whisper soft, but all of them matter. To recap, don't ignore new, unexplained symptoms, especially if you experience chest pressure, radiating pain, shortness of breath, sudden fatigue, or unusual nausea or dizziness. These are serious clues that your body may be in trouble. And for women, older adults, and people with diabetes, being extra aware of atypical symptoms is critical. This video is for informational purposes only and does not replace medical advice. If you think you may be experiencing any of the symptoms we discussed, seek emergency medical help immediately. If you found this helpful, please give it a thumbs up, subscribe, and share it with someone you care about. You never know, passing this knowledge on could truly save a life. Stay informed, stay safe, and always listen to your heart.